A very hearty welcome to all of you. So this time at Mad Medicine, the topic is endometriosis, a part of gynecology. In this, we'll discuss it under following heads, as you can already see. Number one, definition. What is endometriosis? It is the presence of endometrial glands plus the stroma elsewhere, that is apart from the uterus. So what do you mean by elsewhere? Like, what are the most common sites where it is usually seen? The most common site is ovary, followed by the pouch of Douglas, and it may also be seen in the uterosacral. So ovary, pouch of Douglas, uterosacrals. Okay, now coming to the theories, that is etiology, that why does this occur? Like, it does not occur in every woman of the reproductive age group. So why only specific women are predisposed to develop this condition? It's because number one, there is a theory of number one is genetic predisposition, like having a first degree relative with this condition increases the risk by 7 times. Number two, there is a Samson's theory. Okay, number two, Samson's theory of retrograde menses. So usually these women have some Mullerian anomaly, so proper vagina is not developed, endocervix is not developed. So what happens? The blood flow in the menstrual cycle, it goes in a retrograde fashion. So that is retrograde menses. Some other theories are like immune related. Number three, immune related. Number four, they may say that it is maybe related with coelomic metaplasia. Number four, it could be because of hematogenous spread. Okay, it may be because of hematogenous spread, and so this endometriosis tissue, certain research shows it has also been these masses. This endometriosis tissue or the mass has also been found in some patients in the nose and in the lungs. That means there is a hematogenous spread as well. And the last theory, number 6, is of direct implantation theory. Like these endometriosis tissue are many a time seen in the C-section scar or in an episiotomy scar. So these were the 6 theories for the etiology. Now coming to the clinical features. So what do you think will be the prime clinical feature and the most common complaint with which the patient will be visiting you? Number one is pain. What type of pain? When we'll ask the patient, she'll say it's cyclical. It occurs during the menses. That is, we call it as dysmenorrhea. So there is a dysmenorrhea, sometimes even very excruciating, severe dysmenorrhea. So patient will give a complaint of long-term intake of NSAIDs and painkillers. Right. So this dysmenorrhea and the severity of dysmenorrhea as a fact is directly proportional to the extent of involvement or to the depth of involvement. If it is more extensive, it is spreading bilaterally, ovaries are involved, tubes are involved, pouch of Douglas is involved, so the patient will have more dysmenorrhea. Apart from that, since pouch of Douglas is the second most common site being involved, so these women may also complain of painful defecation, painful urination. Okay, because the mass or the tissue is present in the pouch of Douglas, so it is causing irritation of the rectum and there is a painful defecation. Apart from that, usually see, the most common complaint is pain, but there are other complaints also. So the second thing could be this one, infertility. So many of them, they complain of infertility. And in some women, a characteristic triad of 3 symptoms is seen. Number 1 is dysmenorrhea, that is the most prominent. Number 2 is a dyspareunia, that is a coital pain. And number 3 is of course infertility. Right, so you can look out for these particular complaints. Dysmenoric pain, which is directly proportional to the depth of involvement. Then sometimes they may have dyspareunia, and the third will obviously be infertility, because it's obviously seen in the reproductive age group women, and there will be certain of them who want to conceive, but they have this problem of infertility. So we have completed number 1, definition, number 2, theories, number 3, clinical features, number 4, investigations. The best investigation of choice is laparoscopy. In laparoscopy, you see if it is a new or like acute condition. So we see this bluish deposits, bluish black mass. And if it's a quite old endometriosis, then it shows powder burnt appearance. In USG, there is nothing specific, there's just a ground glass appearance. There is a condition of severe endometriosis. Point number 5, severe endometriosis means long-term endometriosis. It has got a lot of adhesions. Number 2, it has caused a distortion in the anatomy. Number 3, it has causes an endometrium, a big mass which looks like a malignant condition. And number 4, it may cause obliteration of the pouch of Douglas. Now the treatment is very simple. Treatment we can go for a medical and surgical, but right now let's have a look at the images. Treatment we can do in the next video. This is endometriosis. You can see it apart from the uterus, in the tubes, in the ovary. Okay. This image shows this laparoscopically how it will appear, bluish in color. This is present in the pouch of Douglas. This is showing a severe endometriosis. A lot of adhesions are seen. This is USG, ground glass appearance.